Good morning, everyone, and welcome to today's virtual press conference. I'm Diane Mihalik. I'm the Chief Marketing and Communications Officer for Munson Healthcare, and I'll be your host today. Today is Tuesday, February 2nd, and as a reminder, we host these press conferences weekly at the same day and time each week in order to keep the community informed about the latest COVID-19 updates and the accessibility of vaccine in our region. Next slide, please. Last week, we were joined by representatives from the local health departments, and today I'm excited to have Dr. Jim Whalen, who is the Chief Medical Officer of Munson Healthcare's Cadillac Hospital and the Medical Director of the Munson Clinically Integrated Network. And also joining us today is Dr. Nick Torney, who is our infectious disease pharmacist with Munson Healthcare. And the two of them are going to help me present some information first, and then we will have a Q&A session. You can submit your questions through the Zoom if you are actually on the Zoom, if you're a reporter. And if not, you can submit them on Facebook, and those will be sent over to us, and we'll try to address as many questions as we can today. So to start things off, it's my pleasure to welcome Dr. Jim Whalen to provide us with some of the local numbers and the current status of vaccine in our region. Dr. Whalen, welcome.
Thank you, Diane. Good morning, everyone. I will attempt to fill the very big shoes of Dr. Nefsi or Dr. Santangelo, who are your usual presenters, and I'll start with running through our current data. So as you look, you'll see that our cumulative cases for the Munson Healthcare region is 23,830. With an increase of 127 over the last 2 days, or over yesterday, so Monday. And I won't read you all of the numbers. You see the current state numbers and our numbers, cases per 100,000, both of which continue to decline significantly. So this very positive trend has been continuing for approximately 2 weeks. Next slide. I'll focus on the Munson inpatient numbers, 23 total inpatients in the system. That, remember, at Thanksgiving time to the first week of December, we were in the 80s, and now we're down to 23, which is really positive trend, and we hope to see that continue, with still, as usual, most of the cases concentrated at the medical center in Traverse City. Here's graphic representation of those same numbers. And you'll see that peak here, end of November, middle of December, and that current steady decline, which is mirrored by the state numbers as well. Our main update today is on of course, the vaccine. So MDHHS is changing the way they allocate the vaccine across the state to really focus both on population-based and need-based allocation process, but any allocation process change has some bumps in it, and we'll talk about how that's affected us. Munson Healthcare's current vaccine supply is already allocated to those currently scheduled for an appointment. So at this point, you heard in the news starting yesterday that we are not scheduling any additional first dose clinics, and we can elaborate on that later. Here's our timeline. As you can see, very rapidly from the beginning of January until the beginning of February, we've been able to expand those eligible for our vaccines. It really is something we're proud of to say that as of February 1st, we've administered 22,080 vaccines, and that 64.3% of Munson Healthcare workers are now vaccinated, and that number has continued a slow but steady climb as well. As I noted, we're not scheduling any more first dose vaccines. It's important to note that if you received your first dose from Munson Healthcare, you will be able to receive your second dose at your scheduled time. We're encouraging people to mark their appointments on their calendars and remember to bring their vaccine cards, and the link, of course, is included in the slides. Our community resources, and each of these have slightly different processes regarding the vaccine. We are encouraging our patients to reach out to their local health department for additional information, while we are trying to continue to collaborate and share messaging with them across the system for each of our regions impacted by each of the individual health departments.
Thanks, Dr. Whalen. We will address some of the additional questions we have about the vaccine allocation, but I think that's a good introduction and a good summary. And again, just quickly before we move on to Dr. Torney, what do you think the impact of the Super Bowl weekend and other businesses opening in that are going to have on our numbers moving forward? Are we still being cautious, or are we optimistic that this downward trend is going to continue?
So we, of course, will stay cautious. We're nowhere near zero. As we noted, there are 127 new positives just in the last 24 hours in our region. So we know the community carriage is present, and any expansion of the opportunity for us to mingle with larger groups increases the likelihood that we'll see more cases. I think a lot of factors are feeding into that. We obviously all have COVID fatigue and are looking for any opportunity to try and have some social contact, which is natural. I do believe that opening up restaurants is appropriate as long as all of the appropriate measures are being followed. But the temptation, again, to be overly flexible about those measures is a risk. It's just human nature. But we do know that there will be a slight bump because of that increase. We're just going to carefully monitor how big that bump is and be ready to adapt on the fly if it becomes larger than we hope.
Great. Thank you, Dr. Whalen. Next slide. Now I'd like to introduce Dr. Nick Torney. Dr. Torney, you've been with us before to provide us some information on the actual vaccines themselves and side effects. So we're looking forward to hearing if there's anything new right now.
Great. Thank you so much for having me. I'll first start with just some expected side effects from the current mRNA vaccines that are available, and those are the Pfizer vaccine and the Mrna vaccine. So things that people can expect are a sore, red, or warm arm. That would definitely be the most common thing, and that's not unique to these vaccines, but many vaccines can cause that. Low-grade fever, headache, just a general feeling of not quite feeling yourself. General tiredness, nausea, body aches, and chills are also something that can happen. And those are all, again, expected and can happen within the first few days after getting a vaccine. And what we've seen is that these are a little bit more common after the second dose. These are expected again, and something that you can do to help with that is just be mindful of planning your day-to-day activities after the second dose specifically. Don't plan any big events after that second dose, and just be ready for that to general feeling of tiredness. Now, things of abnormal symptoms that you want to be prepared for, or not prepared for, but understand to contact your primary care provider. Things like a new or worsening cough, shortness of breath, sore throat. The vaccine should not be causing those things, and that's something that you want to watch out for and contact your primary care provider. I also want to say that these side effects, the ones on the screen here, are really an indication that your body is doing the right thing and mounting an immune response. So those, it's actually a good thing. And I will also note that many vaccines have these side effects, and I'll just close this portion with the risk of these side effects, and even some of the very rare side effects that have been reported in the clinical trials. The risk of those is in magnitudes lower than the risk of COVID-19 and the risk of propagating the pandemic in not getting vaccinated. So I'll end there, and I'm sure there will be more excellent questions that we can address here.
Thanks, Dr. Torney. One question I know that's going to come up is, how long have we seen these types of expected side effects last in people that are experiencing them?
The most common duration is 2 days, 1 day, 2 days, and they could be seen up to 7 days. So that is uncommon, but definitely up to 7 days has been noted.
Okay, thank you. And I just know that most of my friends who have, or family members who've had that have said it was, if anything, it was more like 24 hours. So, and they were amazed that it just kind of went away within 24 hours. So it's interesting, but it's good to know that it could be longer. So great. We were going to share some additional information before I get to our Q&A session today, because a lot has happened since our last press conference a week ago. One of the exciting new developments at Munson Healthcare is a loosening of our visitor restriction policies across our system. We're happy to announce yesterday that we are now allowing COVID-19 positive patients one visitor for 1 hour per day. And this is something that we see as a really positive thing that we can do for those patients, as we know that, you know, having family members there and having visitors there is really part of the healing process. And, you know, as Dr. Whalen mentioned, we all have COVID fatigue, and we want to try to be with our loved ones and family members as much as possible. So that is allowed now for, again, 1 hour per day and one visitor. Those visitors will have to pass all of the screening questions as normal, will have to wear personal protective equipment. So this is additional personal protective equipment, more than just a standard mask that you would normally be issued if you were coming into one of our facilities. So our staff are prepared to provide you with information and to help you properly don and doff or remove that PPE. We are monitoring all visitors for our COVID-19 patients, though. So if anyone is having any difficulty breathing or feeling dizzy or any kind of irritation because of the PPE, they will be asked to leave the room immediately. So excited to have a little glimmer of hope during the pandemic here. We look forward to welcoming some visitors for those COVID-19 patients. And again, that was about 23 throughout our system right now. Additional visitor policy reminders. Again, everyone must wear a Munson Healthcare issued mask. You still have to pass all of the screening questions at all of our doors. We do still collect your name and number for contact tracing purposes. And unfortunately, our cafeterias are not open to visitors right now. So we're asking any visitor who is allowed into the building to go directly to and from the patient's room, or to and from the appointment if it's in an outpatient facility. We're asking everyone to wash their hands or use alcohol sanitizer before and after leaving a room or entering a facility. And please note that there are some additional restrictions that might be in place for different areas of our organization. As you can imagine, we're a very large health system, and there are different sizes of our waiting rooms. There's different patient populations. For example, some of our cancer patients who are getting infusions, there may be some different visitor restrictions around those. So please look at our website that has most up-to-date information on all of our policies before you come. Know what those restrictions are, and then please just be patient with us as we continue to try to do what's best for our healthcare team and for all of our patients to keep them safe. Next slide, please. All right, so I'm gonna have the PowerPoint brought down, and so you can see our faces a little bit better, and we're gonna enter into some of the Q&A. We have some questions coming in. But Dr. Whalen, I'm going to start with you. There is a question about whether or not someone should receive a COVID-19 vaccine if they're about to start chemotherapy or radiation therapy. Do you know the answer to that?
Well, I don't know the specific answer, so it'll be twofold. First is there should be no danger to get the vaccine before you start your treatment. This is not a live vaccine or an inactivated live vaccine. And so that risk of catching COVID from the vaccine is non-existent. And so that in and of itself is not a risk. It does trigger an immune response. And I could foresee some theoretical types of treatments that would be a detriment. And so I would confirm with your oncologist whether or not you should or shouldn't go forward. And I think a lot of it will depend on how quickly after your vaccine you're starting your treatment, and the type of cancer you have may impact that. And I am not an oncologist, so I won't say for sure. But in general, the risk from these vaccines for that type of immunocompromised patient is very low because it is not a live or an activated live vaccine.
Right. And again, that's great advice, Dr. Whalen, that everyone should check directly with their oncologist or their physician in those situations. So thank you for answering that. I'm going to ask, we have a few questions coming in from some of our reporters. One person wants to know what happens with any leftover COVID-19 vaccine doses after our clinics. And I think the answer is we're not expecting to have any leftovers. Is that correct, Dr. Leon? I see you nodding your head.
Yeah, so I have volunteered at the health department clinics, and I have volunteered at the Munson Healthcare clinics. And two things can possibly impact the scheduling numbers and have a slight mismatch between the number of doses available and the number of people scheduled. One is that some of the vials we can get an extra dose out of. And so that is a little bit unpredictable, so we can't be perfect in terms of our scheduling. The other is every once in a while we have a patient not show up, even though they're scheduled, whether they just lucked out and got it somewhere else, and so they just didn't call. So we may have, as the day winds down, expect to have 4, 5, 6 extra doses. We have been establishing lists of people who live nearby who are appropriate, still in the same tiers, and then we just start calling them and see if they can come and join us. So our goal is absolutely 0 wasted doses, and we've been able to accomplish that very, very effectively, both at the health department and at Munson Healthcare. I did hear a story of 1 dose that was wasted because the syringe was dropped on the ground. And so that was not something we felt safe to reuse, but otherwise the number of wasted doses has been minuscule because we planned in advance for that. And surprisingly, those people on the waiting list, they're very willing to rush up and get their vaccine at the last minute.
I bet. Thank you, Dr. Whalen. Dr. Torney, is there any new word on any additional vaccines that are going to be coming onto the market? We've heard of Johnson & Johnson and AstraZeneca. Do you have any update on the availability of those?
Yeah, so it's really, really exciting to see some new manufacturers that are bringing vaccine to the market. There is a lot of their phase 3 large clinical trials are still ongoing, but we have seen some press releases specifically from Johnson & Johnson recently. I'll start with that one. It's a 1-dose vaccine, and it's a viral vector vaccine. Which we have seen before in other viruses that we've used vaccines for in development, such as Ebola. Their vaccine is refrigerated, so instead of needing these really intense ultra freezers to store them, we can store them in a relatively normal freezer, just a -20°C for a very long time, a couple of years, and then 3 months in a refrigerator. So it's a lot easier to manage from a logistics standpoint, and it's a 1-dose series at this point in time that they're studying. The efficacy that they're seeing in that vaccine, they studied it across multiple regions across the world. In the United States, they saw a 72% reduction in mild to moderate disease and an 85% reduction in severe disease, which again, the main metric that we should be looking at is reduction in severe disease, because that reduces the people that are sick on ventilators in hospitals and death from COVID-19. And that is very promising in the press release that we've seen with that vaccine. And one thing to note, this is going to come up here, but the talk of viral variants that we're seeing across the world and now starting to see in the United States, that virus did show a little less efficacy in South Africa, where there are more prevalent viral variants. So that's something to keep in mind as we start to see those propagate, those variants propagate in different areas. But it is important to note, again, even a 50% effective vaccine is still 50% effective, and a 1-shot vaccine is a very promising tool in our toolkit. So I stand very optimistic about this vaccine, and I really hope in the next few weeks. I know that they're working diligently on producing millions of doses of this to be distributed across the world. So very optimistic about that. And then the AstraZeneca vaccine is another 2-dose series. The UK is using it currently, and that has been shown anywhere from 60 to 90% effective. So we're just waiting to see the FDA review that data and see where the United States takes that. But again, very optimistic about those two vaccines in the pipeline.
Great. That's really good news to hear. So we'll look forward to hearing more about that in the coming weeks as all this unfolds. Dr. Whalen, I have a question for you. There was a story in the news yesterday about one of our local health departments in an Antrim County, where some of their systems had been compromised with the vaccine signups. I have not heard of anything like that happening within Munson Healthcare, so I don't believe that anything like that has impacted us. Is that correct?
No, our scheduling system has been working very well. Luckily, ours is a very manual system, not
Right.
simply
It's
an
not.
online system. So it makes it much more hectic if you'd have to hack a human, which so far no one's really been too successful at. So even though it's a little old school, it's a little safer.
It works.
Yeah, and it's worked very well.
Another question for you, Dr. Whalen. Can you share more specifics about pausing the clinics due to supply shortages? What were we expecting from the state, and did we get any, or did Munson Healthcare get zero?
So obviously this is not the news everybody wanted at this point. None of us are excited about it, but it's not really surprising. So we've been getting hints for the last couple of weeks that for the next couple of weeks, supply numbers will go down. As I mentioned right at the very beginning, MDHHS has changed how they're allocating that. So that algorithm, as it's evolving, it has become a little less predictable. So that's been an impact. There's been an impact in distribution to the state, so therefore through the state out to us. And we do believe that with the new administration and once their plans have been operationalized, we'll see an increase in our supply, but we're not surprised that for the next couple of weeks, our supply will be decreased. The exact numbers, I actually don't know the exact numbers. In fact, throughout the course of this last 6 weeks, the exact connection between what we've asked for and what we've gotten, both on the health department side and on the hospital side, has not been very well correlated. So there was actually one time we got more than we asked for, kind of unexpectedly, and other times that we've gotten exactly what we've asked for. So the important real takeaway is that this is temporary. We have enough for all of our scheduled first dose clinics and all of our second doses that are due in the next appropriate time frame. But out of an abundance of safety, until we have vaccine in the system for more first doses, we're not going to schedule anybody. It's as I mentioned, it's a manual process. It's even a little worse if it was an electronic process to cancel and reschedule people. So at this point, knowing we don't have enough to really safely open up a first dose clinic, we're just not going to proceed. We are very optimistic in the next 2 weeks that we'll see an increase over our previous week's allocation in our supply.
Great. And just a follow-up question, is there anything being done to advocate for smaller counties up north who are maybe not being seen as part of this new MDHHS guidelines for some of the harder hit areas? From what I understand, a lot of the vaccine is maybe now going to some of those areas in the state where they were harder hit initially during the first stages of the pandemic and when we saw our big spikes. I know that there are multiple ways that Munson Healthcare engages with the state and advocates throughout we're pretty much advocating every day in some way, but I know that our chief medical officers are on statewide calls. Ed Ness, our CEO, is on statewide calls. Can you just explain or elaborate, Dr. Whalen, on what you know about that?
Sure. So I'd say there's several layers, and certainly Nick probably has some strong insights on this too. So I'll be brief in that Nick comment as well. Um, so the health departments and Munson Healthcare in our region have collaborated extraordinarily well during this. And so we have advocated for each other in all of the venues that we've been able to. So as Ms. Mihaly mentioned, the chief medical officers of all major systems in the state meet weekly and with the state to talk about current issues they have throughout the pandemic. And now it's pretty much all on vaccine, and advocated for distribution consistent with how quickly we're able to distribute the vaccine. So we've done a very good very well distributing our vaccine, and so we feel we should be continue to be allocated, and we've supported our health departments, so they're in the same boat. The health departments have their own organization, and then on top of that, MDHHS has a weekly call where they ask for input from all stakeholders. So that includes the pharmacies, the health departments, the healthcare systems, physician organizations to give input. And that has been also something where they've been very open about taking that input. The one added layer is that the Munson Healthcare's government advocate, Gabe Schneider, has connections with all of our state legislatures and national legislatures. And you saw in the news that we just had Representative Mrna visiting, especially in Cadillac and a few other spots in the system. And he heard our concerns about fair and equitable distribution of the vaccine to Northern Michigan, and he carries that back. He obviously advocates for us as well. And so I really think we're reaching out on as many levels as we can. The reduced supply is not unique to Northern Michigan this week. It's a statewide challenge, not a Northern Michigan problem. Nick?
Yeah, I think you put it really eloquently. I would just highlight and put a star next to the excellent collaboration between the Munson Healthcare leadership and all of the local health departments across our region. And it's really that, in my point of view, that's driving the equal distribution of the vaccine and willingness to help out on both those ends to make sure that those individuals in areas with less resources are still able to get the vaccine.
Thank you both for that, those great answers. That's very helpful. Dr. Torney, sort of as a follow-up to what you were speaking to just a minute ago regarding the different vaccines and new ones that may be coming onto the market, has anyone put any thought into who should receive what type or what kind of vaccine as more vaccines enter the market? So I think the question is you know, we were in tier 1A for healthcare workers. Those were mostly Pfizer vaccines. Then Mrna entered. We started getting into tier 1B. But as these other ones come out that may be either less effective, or they're still effective, but maybe not as effective as the first ones that came out, or there's one dose versus second dose, is there any research or any thought being put into that?
It's an excellent question, especially when you have different vaccines with different properties, different effectiveness rates, different side effect profiles. Although they are very similar, I'll just comment that we do not have, at this point in time, the full publications to be able to really tease out which populations would benefit most from each vaccine. And in the future, that is going to be how, from my standpoint, how the ACIP, who kind of sets the guidelines on the vaccine administration, the clinical aspects of vaccine administration across the United States, they're going to look at this and say, these populations may benefit more from this particular vaccine as opposed to the other. But at this point in time, because of limited supply, if you're in line to get the vaccine, regardless of which vaccine it is, I would advocate for getting that vaccine. And I just want to highlight or go back to the reduced, or and I put that sort of in quotes, the reduced efficacy of these new vaccines that are coming out. For instance, the flu vaccine could be 40 to 50% effective, and that is okay. And the reason is because you're your chances of running into somebody that has the flu are much less. And you also have an immunity to that you still have a 50% chance of not getting the vaccine or not getting the flu virus, for instance. A 60% effective vaccine is still 60% effective, and that is not uncommon for viral vaccines. These 95% effective vaccines that we've seen with Pfizer and Moderna is rare. That is not something that's expected. So I just wanted to double underline that that statement.
Yeah, thanks, Dr. Torney, because we did have a follow-up question that said, why would anyone want a vaccine that's only 60% coverage? And I know that we were talking about this on Friday as we were preparing for the press conference. And Dr. Whalen, you had some great answers around that, about even if as we reach community immunity or herd immunity. Can you just address that a little bit more as well to follow up on Nick's comments?
Yeah, so I think there's two levels to that. And I think really our goal, as Nick said right now, is to prevent severe disease and keep people from dying. Like if we knew that this was just like a cold and everyone would get sick and miss a week of work, but no one would die, we wouldn't even be worried about it. Like it wouldn't even be in the news. But our goal ultimately is to keep people from dying. But our long-term goal, our broader overarching goal, is herd immunity. And herd immunity is accomplished when enough people in the community are immune to the disease, either through previous infection or vaccination, so that we stop community spread. And if there's no community spread, we will stop having new cases, and then eventually it dies out. That's what happens to the flu every year in our communities. So when we talk about a 60% effective vaccine, one of the sciences we trust about vaccines is that not only will it prevent that person from getting as sick, because they have antibodies that'll attack the virus in their body earlier in the disease process, keep it from multiplying and making them sick, because it's the high levels of vaccine in their system that makes them sick. It's also high levels of vaccine in the system that makes them highly contagious. And so in theory, and now this is not proven yet, but believed to be likely, that if you're immune to the disease, you are not going to have enough of it multiply in your system to make you highly contagious. You still will be contagious because you can carry the virus, but you will not be likely to be a super spreader. That magnifies the benefit of each immunized person, and why a 60% effective vaccine still strongly contributes to herd immunity if they are 60% less likely to be a spreader of the disease. And so we can eventually identify a positive, do very good tracing of their contacts, because now we have smaller and smaller numbers in our community, and kind of get around those people and stop the large spreading events and continue then that downward trend in our community spread, which is what really keeps us from being able to gather as groups, safely go to the restaurant, not be afraid to go to Meijer, all of that. So those things are, it's just kind of a positive feedback loop. And that's why we don't need a 100% effective vaccine to still see improvements in our community disease. Hopefully that clears it up.
Yeah, thank you, Dr. Whalen. I think that was a really good explanation. As just one follow-up question, then, we've for those people who have been vaccinated, who've received even their second dose already, why is it important for them to continue to wear a mask and follow infection prevention measures? They could still be carrying some of the virus, correct? And we're trying to protect our most vulnerable populations. Is that
exactly?
Is that
So
the answer?
certainly we know that if you got the Pfizer vaccine in both doses, you have a 95% chance that you're not going to get super sick if you get the virus. You have exactly the same chance of getting exposed to the virus and breathing it in and having it multiply in your body. But now you have a protective device inside your immune system that keeps you from getting sick. It's like chickenpox when you were a kid. Once you've had chickenpox, you can go to a crowd of kids with chickenpox and not get it again, but you could spread it to your brothers and sisters. So same thing with this. You could carry it and spread it to a close contact, which again, this is really, we're trying to protect our vulnerable people. We have to remember that 8 out of every 180 plus year olds who get COVID die from it. And so, even though I'm middle-aged, I'm lower risk, but I see patients who are over 80, and I would hate to be the person who gave it to them, because the person in the room next to them I got it, or the week before I got it, and I still carried it and gave it to them. So it's still responsible of us to wear our masks and protect others, which is what the masks have always done, even if you're vaccinated.
Great, thank you, Dr. Whalen. Dr. Whalen, I'm going to start with you, and then Dr. Torney, I'm not sure if you have any comments on this one. This is a question from one of our reporters. Munson serves communities with a wide range of social vulnerability scores. Can you talk more about how allocation works and whether or not Munson Healthcare will be prioritizing certain populations over others or certain counties over others? I don't know, Dr. Whalen, if you know the answer to that.
Sure. I noticed that in the questions, and I think it's a great question. So thank you, whoever asked this. My answer will be more vague than you hope, and I'm afraid, and that's largely because I don't get to decide the algorithm that the state is using, but that is the change that MDHHS tried to implement, is to try and create more equity. So put the most vulnerable populations ahead of those less vulnerable populations. So we're not 100% sure how we fit on that allocation scale. But once we're allocated vaccine, how is Munson Healthcare making sure the most vulnerable are getting taken care of? And I think that is largely driven by our collaboration with the health departments. So basically, on a very high level, we've agreed with the health departments on how to divvy up who is responsible for who to get the vaccine. The state set very broad guidelines, trying to identify the most vulnerable by their job position and their age, et cetera. So we've subdivided that with the health departments. And then Munson is more specifically subdivided that by starting at our oldest patients and working our way down. Not every community has done that. That's fairly unique, but I think that that's really important. We feel very strongly clinically that that's the right thing to do. Again, like I said, because of that age-related fatality rate, but also because we can. And so I saw a few of the other questions asked, like, how do we know who's most vulnerable? How are we tracking this? And really, we have access to patient registries through our physician offices and through our physician organizations, where we can identify all of those who are 82 plus or 80 plus. And when we get to lower tiers, we'll be able to identify those who are 50 to 65 who have diabetes. Like, we can run that list, we can call those patients and have them schedule the vaccine. So because we have that capability, it is not perfect. Is everyone in there? No, if you don't go to the doctor, we don't have your information, but it's way better than just doing it randomly. And so that's our best way to approach that equity challenge, is identifying people through our offices who the providers feel are most susceptible. And we've done a really good job of that. In terms of the county by county vulnerability, that we have relied on the expertise of the health department to help guide how they're allocating within. I am most familiar with District Health Department 10, who has everything from Wexford County to Lake County, as was mentioned, and they have allocated that within their own like sub-allocation to the best of their ability based on that vulnerability. And we support them in that, even if it feels like maybe a larger county wants more, but if there's a more vulnerable population elsewhere, an older or sicker population, we would certainly support them still getting a higher relative allocation.
Great, thank you. That's it. I know it's complicated and we don't have all the answers right now. So again, we're continuing to collaborate with the health departments and the state, and doing the best we can with what we receive. Dr. Torney, there's a follow-up question about the vaccine itself. Is the Pfizer or Moderna vaccines, are they 95% effective because they're mRNA, or is it for some different reason?
Yeah, that's actually a really great question, and it's probably twofold. The first is that those vaccines had a head start a little bit. Those were, if you remember, all those vaccines were studied before any of these variants came out. So that is sort of like the wild type virus, and likely to be more effective against that. Secondly, it is a 2-dose series. So when I talked about the Johnson & Johnson vaccine, that is a 1 dose being studied as 1 dose. Both of those mRNA vaccines are 2 doses. So we're really giving the best opportunity, that is like the best case scenario, if you will. So in my thought, probably has less to do with the type of vaccine being an mRNA vaccine, and more to do with a two-dose series, and also when those individuals in the study were vaccinated.
Great, thank you. That was a question I had as well, so thanks for answering that. Dr. Whalen, do you happen to know when dialysis patients will be eligible to be vaccinated?
So certainly the vast majority of dialysis patients are in our current open age group of 65 and above. And so they are certainly very high priority, and we are trying to accommodate them as rapidly as we can. Any under 65 would be at the top of the list for the vaccine once 1C is open. And so I think that, again, those lists are easily available in our various offices. We can run those lists, and we will keep those people at the top of our priority list as soon as they are eligible. Anyone 65 and above on dialysis should be able to schedule as soon as we're able to open more clinics and finish doing 1B. We should be able to get them in. There would be no reason why they couldn't schedule. In the Munson system, it would be we're doing it by age, but the health department, once they start opening up clinics to patients in general over 65, dialysis patients should be able to schedule there as well. So it's, I mean, they're likely, many have already been based on how we've done.
Got it. Right, and that's a good reminder that even as Munson Healthcare and the health departments were running our vaccine clinics, we were doing that by different age categories. So again, Munson Healthcare was only at 80 plus, and a lot of the health departments were doing 65 plus. So again, it's just really important that people go onto our websites and kind of see all those differences until we can get things more streamlined or consistent across the region. That may take some time though. I'm going to ask this of both of you. I'm not sure who wants to answer it, but are there any medications you should not take before getting vaccinated?
I'll start, and then I'll let Dr. Whalen kind of mop up my anything that I say. So I would say there isn't anything specifically that has been identified that interacts with the vaccines. So for instance, if you did take a over-the-counter Tylenol or Motrin or something like that, there's really nothing to suggest that would cause a less immune response. However, loading up on Tylenol or Motrin before the vaccine to try to prevent any vaccine related adverse events is really not recommended. As I mentioned before, it kind of takes a day or so for those adverse reactions that are typical, like sore arm and that sort of thing. So you by giving a dose before getting the vaccine, you're really not preventing any of that. And so we would really just recommend waiting until those occur, and then using safe doses of those over-the-counter medications. Of course, talking to your primary care provider first to make sure that those are safe based on your specific clinical scenario. But yeah, and Dr. Whalen, please chime in here, but I am not aware of any medications that have direct effects on the vaccine efficacy.
There was a lot of press in the last week about pre-medicating with Tylenol and Motrin before you got your vaccine, because there was a study that showed in children, if they were pre-medicated, they had less of an immune response to flu vaccine some years ago. So theoretically, that they extrapolated that to say maybe that's true for this vaccine. We have no idea whether that's true. But like Nick said, even more importantly, it's a complete waste of medication. It's not going to prevent a single symptom. It's not going to reduce the likelihood that 24 hours later your arm hurts or that you have a low-grade fever. So we never want people to take medications that have no potential benefit. So there would be no reason to take any medications beforehand. The only thing that, and this is really broadening your question, and so if this is not what you're asking, I apologize for unnecessary information, but some people on very strong immunosuppressant medications, intentionally that's reducing their immune response, they will have lesser immune response to the vaccine. That is, again, just like the cancer patients, something that you should discuss with your physician to make sure how you would approach that. No one has done a study on 10,000 people getting some medication like that and the response specifically to one of these vaccines, so we can't say with certainty. It's just theoretically, if I'm purposely blunting my immune response, will I blunt my immune response to the vaccine? Yes. So theoretically, just have that discussion. That said, blunting does not mean eliminating, and still, if you must have that immune response medication, we would never say don't get vaccinated. We know it still would work, although it may not be as potent or equally effective to some younger person or otherwise healthier person who got the vaccine.
Great, thank you. And we are out of time, unfortunately. We had some great discussion here, and I'm glad we got some more of the questions that were actually coming in. It's difficult to do that sometimes on these when we have so much information to share. A lot of the other questions that I'm seeing come in are related to specific, where do I go and how do I get my vaccine if I've had it scheduled. So just at a broad level, if you had a vaccine, if you've had your first dose, you should go to the same location to get your second dose. There was a question about what if I receive my first dose somewhere else? Like we are hearing about some people who are maybe, have second homes in Florida or something and are maybe got a first dose there and are coming back trying to get their second dose here. Munson Healthcare is not doing that currently. However, some of the local health departments may have a different policy on that, so you would have to ask the health departments about that. But just know Munson Healthcare cannot give you a second dose if you received your first dose somewhere else. Continue to go back to the same location where you got your first dose if you received it through Munson Healthcare. There was a question here about Hagerty Center. That in Grand Traverse County, that vaccination clinic was run by the Grand Traverse County Health Department, not Munson Healthcare. So you may want to reach out to the Grand Traverse Health Department to get your question answered there. And then the big question is when will vaccines be available at Myers and Walgreens and all these other places? And I think Dr. Whalen, can you just say that we just don't know yet, right?
So I'll say we both don't know, and we really hope that it'll actually be in your personal primary care physician's office before it's at Meijer, but that's unfortunately less likely. And I did see several questions about if there's bad weather or if I have to reschedule, how's that going to work? Almost everyone should have gotten their second appointment at the same time they got their first shot. And so when you get your second appointment, if there was a weather event or you had a personal challenge making it to your second appointment, you would simply call the scheduling number to reschedule. And we have some flexibility on that. We can certainly shift that around a little bit. So it wouldn't mean you would miss your second shot. We would be able to accommodate you. I agree with Diane's comments though about those who got a shot somewhere else and are looking then to get their second shot up here. The way vaccine allocation has worked to date, that is really not a very effective situation, because we have to record how many first shots we're giving, and then we get allocated only the exact same number of second shots.
Right. We
would not have flexibility there to accommodate someone who had traveled to get their first shot. So in hindsight, we would wish you hadn't done that, but you would have to contact where you got your first shot to make some kind of arrangements regarding your second shot at this point.
Great. Well, thank you both for joining us, Dr. Whalen, Dr. Torney. It's always a pleasure to have Dr. Torney back with us. And Dr. Whalen, will definitely have you back sometime in the future as things continue to change. And I just want to close by saying, here's the community resources that are available. Also, continue to follow munsonhealthcare.org. Look at our website, follow us on Facebook, on Instagram. And as soon as we are able to open up vaccine clinics again, we will get that information out as quickly as possible and begin that process again. But again, we ask for your patience as we continue to work with the supply and demand issues of this pandemic. So again, thanks everyone for joining us. And if we didn't get to your question today, we will try to answer it on our FAQ section of our website. And again, this session is being recorded, and you can go back and view any of the previous sessions we've had. And with that, have a great day, everyone. Thanks.
Thank you.